Welcome back. Well, yes, indeed, we're joined by the Minister of Health, Dr. Osage Ehanire. Good morning, and thank you for joining us today on the program. Well, it's something that the country wants to get a solution to. Well, first, we're starting off with the situation with the doctors' strike. What is the latest position?
Well, the latest position is exactly as the young doctor just described, Dr. Ojebo, that they are withdrawing services and creating scarcity of service or those services at our general hospitals. We are beginning to worry about the consequences of 8,400 doctors leaving the system at this very critical time. Not that Nigeria had one of the strongest health systems in the world, but the advent of the coronavirus disease has obviously increased the strain on the health system. And that's not only in Nigeria. You look at all other countries, exactly the same thing, even up to the United States. Russia, if you look at international news, which I know you do, you will see that various countries have suffered a huge pressure on their health system. The UK, Spain, Brazil, all countries are suffering, not only the strain, but also the shortages. There are shortages of materials and personal protective equipment, even masks. There are some major countries that had a tussle over 200,000 masks not long ago. So we are going through a very difficult time, along with other countries. And quite clearly, this is the worst time for someone to add more to our problems by deciding to go on strike and compounding our problem. I worry that we are probably the first, perhaps the only country in the world where doctors choose such a difficult time to withdraw their service, whereas in other countries, doctors, nurses, those who are, even if they have retired, are all returning to work to help because they know that their country, their people have a problem. There is an emergency, and this emergency is everybody's problem. It is not just the government alone. It's everybody that's supposed to put all hands on deck. And some people are taking their hands off the deck.
Now, your meeting with the doctors, I mean, yes, we all want to see a solution, as highlighted previously. But it appears it didn't come out well, or did it, because they just say there wasn't any pen put to paper. What happened in the meeting? Did it go well from your perspective?
Well, the young doctors, the resident doctors, popped in at my office yesterday unannounced. I didn't know they were coming, but I immediately stopped everything I had on my program and met with them. We had a meeting in which I repeated just what I'm saying now, that we are in the unenviable position of being globally the first and only country where the doctors are going on strike. And that this was not good for our image and also not good for the results we have. Now, we are not yet at the peak of the coronavirus problem. And if you are going to take your hands off the plow at this time, then we are going to have issues which will be seriously embarrassing for us as a country. We have a case fatality rate now of about 3 or less in some places. We are worried that this case fatality rate will increase, and also the withdrawal of service for other services, other ailments, which we are already worrying about. Maternal mortality, we are not doing well. Infant mortality, under 5 mortality, we are not doing well in any of these ones. So the worst thing we want to see now is that our indices begin to rise even further. I told them all of this, and I also assured them that their grievances will be looked into. Some of these grievances date back from 2014, that is 6 years ago. And you choose this time of the year to bring it up. The meeting I had with them yesterday was actually the very first one-on-one I had with them, because they hadn't been to the ministry to have this chat. And when they came in, the directors were there to also talk to them and try and counsel them. Now, they left without saying anything, and I was under the impression that they had understood, and they were going to at least show some empathy and begin to consider calling off the strike and going back to work in the interests of the citizens and those who are in the hospital languishing. But I haven't heard from them since then. I do not know what decision they have taken. But from the conversation I just heard just now you had with the vice president of the association, it looks as if they're still holding the same stance.
Well, the challenges Nigeria's health sector is facing notwithstanding, I mean, everybody wants it to be sorted. But it does appear as though there is a communication problem and that government has a huge role to play. I mean, put simply, the ball is in government's court. The doctors don't seem to have the confidence from the government. They think that government says one thing, and then they look at it, they're not putting their money where their mouth is. So they say one thing, but what they see in reality is different. So how do you expect them to actually go with those kind of circumstances?
The Speaker of the House spoke with them and reassured them. The chairmen of various health committees in the House spoke with them, reassured them. The Minister of Labour has spoken with them. I have spoken with them. I think all these voices are enough from both the legislative arm and the executive arm. We've tried to persuade them that we are in a tough situation and trust us, we'll take care of you. I am a doctor too. I went through residency for very many years. I know what it's like. But I will have a very serious guilty conscience if I were to choose a moment of weakness to start launching an initiative of this sort, which will definitely not be pleasant for some people in the country. So the issue has to do with some trust. You can't have trust in your government, particularly this government. We have made it clear that this government is the most serious and most sincere government that this country has ever had. So its word is its bond. You know that this government made a promise to pay pension areas that were long overdue. Remember the Nigeria Airways pension areas which were long overdue, had been carried from one regime to the other. It is this regime that paid it. And the same for those who had worked, I think, the police men who had worked in the Biafra era. This government paid it. So this government has a record of being sympathetic to people, of meeting its obligations, and also of keeping to its promise.
It would seem like that trust is greatly degraded, has been greatly degraded over the years. Well, you're talking about this government, but from one of the things that you heard Dr. Ojebo said, some of these problems are age-long, some of them running into decades. You know, this government just came into power in 2015 and up until now still in power, but there are people working with this government in the civil service who have understood these problems, and they have been part of several agreements put to paper that have not been done, nothing has been done about them. That's why the doctors would say that government will agree to something, but they will not make good on their promises. So is there a system to ensure that the agreements that are reached with these doctors are actually executed and that the doctors can then have confidence in government that indeed not only you, the minister, but all the people in the Ministry of Health will ensure that whatever promise is made is fulfilled?
Well, it's difficult to convince someone if they are determined not to be convinced. Over the years, the people in the Ministry of Health are not the same. They have changed. The government has also changed. And I just told you now that this government does things differently. This is a government that meets its word, makes a promise, and actually meets it. So that's enough backing. Also, the ministers have changed, the directors have changed, the permanent secretaries have changed, and they are all giving their word and their promise. And we're all doctors. We know what you feel like. And we will not do anything to hurt you. We work in your interest. So it's difficult to give any other form of assurance. And I would also say that there are probably a lot of assurances that have been given unfulfilled, and not all. Some of them are contentious. There are some that are in court. As a matter of fact, some of the ones about 2014 is in court, and we can't decide on those subjects while they're still in court. And there are other demands that the federal government cannot itself directly attend to if there is a particular issue between one state and the doctors working in that state. And you want the federal government to be able to solve that problem for you. Well, we shall try to put in a word, but we cannot guarantee that we can provide you the answer. That's an issue between the doctors of that state and the government of that state. Now, the National Association cannot hold the entire country, the rest of the country, responsible for what happened in one state.
I mean, talking about trust and still on what the government, this current administration can do, for the resident doctors, I mean, you talk about trust, but for them, they say seeing is believing in terms of the personal protective gears. They say once they get it, then they can say, yes, we trust you. In terms of hazard allowance also, they're saying it has taken months. This has been in the works, but not all of them have received. In fact, just a little percentage of these doctors have received. So in terms of the trust, how hard is it to put this trust into action such that they see it and they say, yes, indeed, you mean what you say?
A few days ago, we had a long discussion that took probably 8 hours of negotiating at the Ministry of Labor, in which the ministers were trying to persuade them that this allowance is being paid. At that time, it had not been paid, and they wanted evidence. And they said that if it would have been paid, if one person had received an alert, then that will indicate to them that it was going on. And although evidence was shown that the money had actually been paid out of the Ministry of Finance, it has to go through a system from TSC accounting to a commercial bank account. That takes some time, it takes perhaps some hours. And they wanted to have evidence that if a few people could claim that they had seen an alert, then they will be convinced that it was going on. Now, in a moment, they will say that 11 institutions have seen that alert. So it tells you that it's going on. What else do you need to build trust? So now the 11 states are no longer enough, or rather 11 centers are no longer enough. The rest is coming on. We did mention the other days when they will be paid according to the timetable set up by the Ministry of Finance, and also the mechanisms involved. I'm convinced that this money will be paid, and you can take the word of the government for that.
Right. So, I mean, they, on the other hand, will say, okay, maybe we'll just wait till all the monies are paid. But you know what we all want is for the doctors to come back so we don't have a bigger crisis on our hands. And I mean, you mentioned that you went through residency, and just hypothetically speaking, if you were faced with these challenges, I mean, inadequate PPEs, as they have said, the issue of hazard allowance, you know, the medical residency training framework, which they want to be put in force, medical health insurance also. If you were faced with these challenges, what would you do?
Well, let me tell you what I will do. In the first place, I have already said earlier on that these are not challenges that are unique to Nigeria. In other countries, if you can recall, if you looked on television, the UK had to start going to look for PPEs from Turkey, and because they had run out, and people were improvising. They were trying to use garbage lining, garbage barrel lining. Same thing in Spain. They understand that this is a difficult situation for everyone, and everybody must contribute. Everybody must take the brunt of it. So they try to use different things to improvise, to cover themselves, and to create their own masks and reuse masks. In fact, the WHO had to come up with guidelines for reusing face masks because there was a global shortage. Now, we don't manufacture, we have to buy, we have to procure, and we are doing quite a good job on that because I personally put a lot of emphasis on it and make sure that we have a stockpile, and the stockpile will be able to meet the demand of any place where there's a sudden shortage, where there's a sudden rise in use. Of course, we are pleading for judicious use of this equipment, if you use this equipment carefully and cleverly, because we don't manufacture and they're quite expensive. And we still promise that we will, in fact, we are going to take delivery of some equipment and PPEs tomorrow, Saturday, which is coming in into Abuja tomorrow. It's already arrived in Lagos. So we are making sure that we provide all these equipment. Now you ask me what I will do. I will also think I also think of the patients. I also think of the others who are suffering, who are languishing, people who can't breathe, people who are running to the hospital and finding no doctor, women who want to deliver and they're in labor, there's nobody there to attend to them, and immunizations that are due and they can't be given. So I will also think about that, and I will say, okay, good, let me go back to this job, and then I'll go and fight for my rights later on. And that's what I'm pleading with them, in that they have chosen a very difficult time at the moment when they have a position of strength, and it looks like the people they bargain with are not really need them badly. But in reality, it's a country that needs us doctors very badly, all of us. And I can see a situation where even doctors who have hung up their stethoscope will come back and say, look, we can't wait and let people die. Let us come and see how we can help. And that's what I expect these young doctors to do.
All right, but Dr. Ehanire, well, the chairman, PTF, on COVID-19 was quoted copiously saying he didn't know the health sector was this bad. And having identified it, what is being done? What is the plan for the health sector?
Well, let me say generally that what COVID-19 has done is that it has shown that no health system was that strong. The health system in the UK, in Spain, even in the US, as we are seeing now, all these health systems were brought on their knees because of the sheer volume that this disease throws up. And no health system was ready for it. And I don't know any health system that really could cope with it. You know that the Chinese had to start rushing up 1,000-bed hospitals within a number of days because what they had on ground was just not enough. So it's not quite fair to be bashing the Nigerian health system. We know that it's not good, it's not very strong, but you can't be bashing this system against the coronavirus disease because it's taught the whole world a completely different lesson. Now, we're using the lessons learned to reshape the health sector.
Not that we're bashing the health system, Honorable Minister. My apologies to jump in. Not that we're bashing it. We're saying haven't identified the challenge, because those other countries, they saw the challenge. It took them unawares, but they've ramped up efforts ever since then, and they're doing something about it based on data. So what are we doing about ours? Haven't identified this problem. That's what I'm asking.
Yeah, that's what I'm answering also, in that you are going to, as I told you, we are getting supplies again tomorrow coming in by air. We are doing everything to bring in supplies, to import supplies from everywhere. We are bringing in these hazard allowance. I mean, not all countries are even paying hazard allowance, mind you, but it's something that we already initiated on our own even before anyone asked for it. And I've spoken with doctors in other countries who said there's nothing like that. That's your job anyway. So we are bringing that in, and as an additional incentive, and also the life insurance, which is coming in, and the various other initiatives to ensure that our health workers are safe. But the changes you are talking about are not changes that you are going to see overnight. In the first place, we have to deal with this situation, the situation we are in. How do we take care of people who are sick? How do we anticipate how many people are going to be sick? How do we make sure we have all the supplies? How do we make sure we have the bed space, the personnel, the doctors? How do we use what we have most efficiently and most judiciously so that it will last us? Now, at the same time, we're looking at what do we do about our health system. We're already building isolation centers all over the country, which we hadn't in the past thought of. We are beginning to build ICUs. We are piling of ventilators, and we are discovering right now that in fact what we need are oxygen generators. We are going to start placing more orders and more emphasis on oxygen generators. So the health system is responding in its own quiet way into these challenges. And there are things happening, I can assure you of that. And also the primary health care at that level is swinging into action. We are going into case finding and surveillance and community-based management of cases. There are many things that are coming up and things we are learning, not only here, but also learning from other countries, learning from the mistakes that other countries made, and also from the victories that they have had.
Let's quickly touch on, COVID-19 figures, what we're seeing now. Yesterday, we recorded the highest daily cases so far, 745. Now, at this stage, 4 months into our COVID-19 battle, we're really hoping that we'll start, dipping and hopefully get this under control. But it seems that is not happening. And I know you have a vantage position. Earlier on, while moving into this phase, you said our decisions will be guided by data and science. When you look at the data, what is happening?
Well, when you look at the data, what is happening is what is happening in nearly all countries in the world, in that you have a high rise, and eventually everyone is trying to flatten the curve. We are also using data and science and hoping that you reach that plateau and then begin to see the dip. But what countries are also worrying about is the case fatality. Out of all the cases you are getting, how many are you able to treat successfully? How many are you losing? And what tactics do you want to employ to make sure you minimize your losses? So those are all things which we are looking at very carefully. Yesterday in my speech, I decided that I will focus on giving particular attention to the vulnerable group, those who statistics and data show the majority among the fatalities. And those are the ones with pre-existing ailments, and those who have who are above 50 years old, and that they must have particular attention. They must be the ones that we urge most to stay at home and to go out only when it's absolutely necessary, to wear a mask and to avoid crowds and to avoid crowded areas, to walk in the market very deliberately. In fact, not to go to the market unless it's absolutely necessary. The same with social gatherings, even religious gatherings, because they are vulnerable. So if we can protect this vulnerable group, we can reduce the fatalities, we can minimize the fatalities. So that's the way we are adapting to various lessons we learn along the way. And the cases rise because we're in the phase of community transmission, but we're also successful in curing many of the cases that arise and saving the lives of those that will have been lost. And we do not want this strike to add to the sadness that will befall our country.
Lastly, these figures rising are definitely giving everyone concern. And one of the issues that people have talked about over and over again is how we coin our communication in a way that people can own it. Yes, we have departments of people who know the implications and don't just seem to care. But then we are more concerned about those who may not be getting the message of the information we are putting out right. How concerned are you about this? And what is the ministry or the committee doing about it, the task force doing about it?
Yes, you are correct. The message is extremely important. There is no public health situation where messaging has been as important as this one. And you can see from the experience of various countries that if they didn't get the messaging right, they made a lot of errors. Here, the Ministry of Information has been doing a great job working with the National Orientation Agency to generate jingles. Center for Disease Control is doing the same thing, Ministry of Health, and all those who are involved, and a lot of volunteers too. I've seen a lot of foundations and NGOs that are involved in trying to generate the right information and try to have a good penetration of this information. And that this information should particularly reach those who it is supposed to reach, the vulnerable. And then the others who will carry this virus and themselves not feel any symptoms. There are people who have no symptoms, but they will carry that and persuade such people to agree to go into observation. We don't want to use the word isolation anymore, for the period for which they are infectious, and then to be released when they are no longer infectious. So the messaging is strong out there: washing of hands, social distancing, or the things we call the non-pharmaceutical interventions. We are emphasizing, translating to various languages, and trying to reach penetration down to the grassroots, and also looking for people to show good example. If you showing good example for those who respect you and look up to you, they will definitely emulate what you are doing. And we also tell people that you wear a mask, you wear a mask. I'm in my home right now, sitting here, and I don't need a mask. But once I leave here, I wear a mask, and when I'm talking to you, I make sure my mask is covering my mouth and my nose. You still find people who take down their mask when they want to talk, which is exactly the opposite of what the mask is supposed to do. It's supposed to catch the emissions coming out of your mouth or out of your breath as you speak. So we use every opportunity, like this very one now, to educate the public on the non-pharmaceutical interventions that can save lives.
All right, so we're all in this, so we'll have to all do what we can to ensure that we save ourselves, help our country to help us. But we do thank you for talking to us today, Dr. Osagie Ehanire, Minister of Health. And all the best to yourself and the team.
Thank you very much. Thank you for your questions, and I hope you help us spread the message out there and let people understand that this is not just a fight for the government, it's a fight for all of us. All people are involved, citizens and professionals, all of us are in there.
We'll absolutely do what we can to help our country.